older adults and mental health. Good evening, folks. I've got C for you. Tonight's C deals with older adults and mental health. So we're going to dig into that one for tonight's C. So please join me for tonight's presentation and please enjoy. Okay. Title: Older Adults and Mental Health. The National Institute of Mental Health emphasizes that aging brings both expected transitions and unexpected challenges. Coping with serious illness, the death of a loved one's, or the shrinking of social networks can weigh heavily on older adults. While many adapt with resilience, persistent grief, loneliness, or stress can evolve into diagnosable mental health conditions such as depression, anxiety. The page underscores that these are not inevitable parts of aging, but treatable health issues, and that effective interventions can restore well-being and independence. Why mental health matters. Mental health is inseparable from physical health. Emotional stability supports daily functioning, decision making, and the ability to maintain relationships. When mental health problems go untreated in later life, they can worsen chronic illnesses like heart disease or diabetes, increase disability, and reduce overall quality of life. The page stresses that early recognition and treatment, not only improve psychological outcomes, but also help preserve independence, reduce hospitalizations, and enhance longevity. Signs and symptoms to watch for. The page provides a detailed list of warning signs that family members, caregivers, and older adults themselves should monitor. Mood changes, persistent sadness, feelings of hopelessness, and or a flat emotional tone. Energy and sleep shifts, insomnia, oversleeping, or unexplained fatigue. cognitive changes, difficulty concentrating, indecisiveness or restlessness, behavioral changes, withdraw from social activities, irritability, risky behaviors, or misuse of alcohol and drugs, physical complaints, chronic headaches, digestive problems, or unexplained pain that may mask emotional distress. Severe warning signs, hallucinations, obsessive or compulsive behaviors, or thoughts of death and suicide. These symptoms are framed as cues to seek professional evaluation rather than dismissing them as normal aging. How to get help. The page recommends starting with a primary care provider who can assess symptoms and connect patients with mental health specialists, such as psychologists, psychiatrists, or clinical social workers. Treatment options include psychotherapy, medication, and community-based supports. Importantly, the page encourages open communication with clinicians to tailor care to each individual's needs, recognizing that cultural backgrounds, personal history, and social context all shape how older adults experience and respond to mental health challenges. Hotlines and resources and research. For immediate crisis situations, the page directs individuals to call or text 988 or use the 988 Suicide and Crisis Lifeline Suicide and Crisis Lifelines live chat for life-threatening emergencies. It advises calling 911 beyond crisis care. The page highlights federal resources such as SAMHSA, the National Institute on Aging, Medline Plus, and the CDC, which provides information in local service locators. The NIH or the NIMH also underscores its role in advancing research on late life mental disorders. Clinical trials test new ways to prevent, detect, and treat conditions. And diverse and diverse participation is encouraged to ensure findings apply broadly across populations. Older adults are urged to discuss trial opportunities with their healthcare providers as participation can contribute to scientific progress while offering access to innovative treatments. Practical next steps. Notice changes. Pay attention to persistent shifts in mood, sleep, appetite, or behavior. Talk early. Raise concerns with a primary care clinician or mental health professional before problems escalate. Use crisis resources. Call or text 988 for immediate support if someone is in danger or experiencing suicidal thoughts. The page central message is clear. Mental health is vital at every age, and older adults deserve timely, compassionate, and effective care that supports both emotional well-being and physical health. Summary of the article. The piece outlines practical, evidence-based ways families, caregivers, and communities can support the mental health of older adults. It frames mental health challenges, depression, anxiety, cognitive decline, and loneliness as common but treatable issues, and emphasizes a multi pronged approach that includes medical care, social connection, physical health, and environmental safety. Just a second, guys. Main challenges described: emotional risks, grief after losing loved ones, and stress from health or life changes can trigger depression and anxiety. Cognitive risks. Dementia and Alzheimer's disease are highlighted as conditions that affect memory, thinking, and behavior. Social risks. Reduced mobility and shrinking social networks, increase loneliness and isolation. Recommended strategies to protect mental health: regular health assessments, routine checkups that screen for depression, anxiety, and cognitive impairment to enable early intervention. promote physical activity and nutrition, exercise, walking, swimming, yoga, and balanced meals to boost mood and cognitive function, encourage social engagement, maintain family contact, join community centers or clubs, volunteer and use technology, video calls to reduce isolation, provide mental stimulation, puzzles, reading, learning new skills, and music help preserve cognitive abilities. Offer emotional support and counseling, open conversations, support groups, and professional counseling when needed. Ensure a safe living environment, good lighting, clutter reduction, routines for those with cognitive impairment, and personalized spaces to reduce anxiety, clinical care, and professional help. The article stresses access to geriatric mental health professionals, psychologists, uh, psychiatrists, and counselors, and notes to therapies that like cognitive behavior therapy and reminiscent therapy with medication use when appropriate under close supervision. It also highlights the importance of managing chronic pain and other medical conditions that affect mood. Practical next steps you can take today. Schedule a routine checkup that includes mental health screening for folks. Add small daily activities, a short walk, a puzzle, a phone call with a friend, or a shared meal. Make the home safer and more familiar. Reduce fall risks and keep comforting items visible. Checklist or a short handout for caregivers. Okay, guys, that's your C for tonight. Let me see if I can jump back on and do a D after a little break. I'll let you know. For now, Gator Wellness, take care, folks.